Hello everyone, I'm Meena Norona and I'm back with another episode of Walk the Special Path. Today we have a very special person today with us. Welcome Dr. Ramandeep Kaur.
Thank you.
Dr. Ramandeep Kaur is the director of Speranza Inspiring Communication, Mangalore, and presently she is also the assistant professor at Father Muller College of Speech and Hearing. She is a speech language pathologist and audiologist. She today is going to address the speech problems in special needs children. She is a Montessori teacher training course, and she has done sensory enrichment therapy. She also has a diploma in child psychology and applied behavioral analysis. She has published a book on body awareness for children with autism in 2022. All the special needs children at one age or another, they have speech issues, communication problems or social issues. It may be autism, Down syndrome, cerebral palsy or any kind of learning disability or mental challenges. I think every parent out there has some questions, some queries, some doubts in the mind. Today, in our talk with Dr. Ramandeep Kaur, we are going to address some of these issues, mainly which occurs in all the special children regarding to speech and communication. Doctor, it's a pleasure to have you here with us today.
Thank you.
So, Doctor, discussing what would you say the common speech problems are seen among special needs children today?
The common problems, you can divide it as the language problems, like you said, special children, so children with autism or intellectual disability or ADHD. So all these children are going to have a speech delay because they have difficulty in understanding the language and then talking it out. So one set can be these kind of language problems. The second thing is specifically related to their clarity of speech. So let's say the speech will be up to the age, but then they will not be very clear in what they are talking.
Okay.
Third set can be related to their voice or related to the clarity in terms of the fluency. That is, let's say, stammering kind of problems or some blocks in their speech. So there will not be a good flow in their speech. So these are the three types of problems which are specifically speech related.
Okay, thank you, Doctor. Now, some children have, they cannot pronounce properly. And parents tend to say, oh, my son is or my daughter is not speaking properly, the pronunciation is not proper or the articulation is not correct. So, can you describe more on these articulation problems, Doctor?
Yes. So, articulation, like you said, are pronunciation problems. So, the sounds that the child is going to speak are not going to be age appropriate. So, the language is fine at this place. So, let's say he is talking in complete sentences, he is talking in words and appropriate to any other child of his age. What he doesn't do is the clarity is not good. So let's say if he is saying kurkure, he may call it as turture, or if it is cat, he may say it as tat. So again, now this is okay for certain age level. Let's say the child is 1.5 or 2 years old, it is still fine. But when the child reaches 6 years, at that point this kind of utterance is not really acceptable. So these are the kind of articulation problems. Every sound, I would say, has a age level within which it should develop. So if you call kurkure, so k sound generally develops within 3 to 4 years max to max. So after 4 years also, if these kind of problems are present, then you start calling it an articulation problem.
Okay. I think in normal children also we'll see a lot of articulation problems.
So these are all the normal children because you would just call them misarticulation because the speech is good in them. They are talking with everybody, socializing with everybody. It's just that the clarity becomes a problem. So people are not really able to understand them.
I think it's more in special needs children.
Children also, yes.
Now many of these children we have found, they are either non-verbal or when they are verbal, they stutter a lot, and that is causes a lot of social problem as well as communication problem. So doctor, is stuttering treatable? And what areas need to be treated for this cause? Because many parents out there, they say my child speaks but is not able to pronounce, is stuttering, So what areas need to be targeted for this?
See, stuttering, like you said, is the flow of the speech. So the children are children, or it can be seen in adults also. So there is this flow which is interrupted. So the reasons for this could be at various areas, like in your speech when you are talking, we are specifically working on, or the system that is involved into this is the respiratory system, number one. So respiratory system means the breathing needs to be corrected, or the muscles which are responsible in that should be corrected. So one is just this system. Next is going to be from where I am producing various sounds, just the sounds. Let's say ah, if I am saying. So I am not changing the sounds, it is just the production of those sounds. So at this level there could be a problem. Third problem could be with the speed, I'm talking very fast, or the transition that I'm giving from one sound to the other. Again, the muscle coordination between the three systems. So all these could be the causes. Another cause could be a mental stress or something like emotions, like I'm very conscious about what people would say when I'm talking, or some small incident, let's say somebody shouted at me, and that's when the stammering started, and I repeatedly keep thinking about that, and this mental stress could cause my stammering to become a little higher. So yes, it is totally treatable. So these all systems can be treated, but what is important is the mindset that I am going to come out of this kind of problem. So generally it is the mental status of a person which decides whether the person is going to come out of his stammering or not.
But here when you say mindset for special needs children, it's more tough, I think.
Yes, special needs children, generally the problem becomes higher because there are language issues, there could be speech clarity problems also, and then when there is stammering, even to teach them certain techniques, it becomes a challenge. So at that point of time there is a higher level of patience and the treatment that you require.
But it is treatable, as you say, it's treatable,
totally, yes.
but they need more patience and time.
Right.
So doctor, for these all nowadays for special needs children, every area we have therapists, all sorts of treatments are available now. For speech therapists are there. So, but parents are always confused, like where to go, how to get a good speech therapist, or should I go to a speech therapist or not? So, how do we choose a speech therapist for a special needs child?
If you ask me, in India specifically, to search for a speech therapist or to work as a speech therapist, you require a basic degree of BASLP. Now this is Bachelor in Audiology and Speech Language Pathology. So this certification is the minimum that you require to start working as a speech therapist. So as a parent, when you're looking out for a speech therapist, you can look for a minimum degree of this sort. Second thing, I would say a speech therapist is never going to hide and work. So it's always a parent to be involved, a lot of report writing to be done, documentation to be done, the other professionals to be involved. So all these things is what will help a parent decide whether the speech therapist is good or not. So if a speech therapist is keeping a clarity with you, telling you what exactly is happening in the session, what are you supposed to do at home, and how are you supposed to generalize whatever techniques are used in a real life. So if your therapist is doing all these things, you can call it a good speech therapist.
Okay. I think because sometimes we really don't know, parents are confused and they are always in search of treatments, cures, and whatever best person somebody suggests, they go to that person. Right. So I think we have to be very careful when we choose a speech therapist.
It's ultimately the mother's participation into the session that even makes any professional start getting onto their feet and start working with things. So if
but
the
mother parents sometimes they don't allow the parents to enter also.
Yes.
That's why
that's what I said, the transparency is very important, because
Correct.
a speech therapist we cannot work all the time with the child. So it's the mother who can really see a lot of things. So yes, the speech therapy sessions can be around 45 minutes, 1 hour, 2 hours, it can be anything like that. But beyond that, the parents need to also work. So a good speech therapist will always keep a transparency and tell the parents what needs to be done.
Okay, I think that between the parent and the therapist, that communication is very important.
Right.
Thank you, because I think parents need to know, sometimes the parents don't know what exactly the therapist is doing. So the speech therapist has to be clear with the parent, and the parent also, I think, is to communicate better with the therapist to benefit the child.
True.
So what will be the challenges a speech therapist will face, because he or she may not be able to communicate well with the child, or different type of children will come. They may be hyper, they may not sit together, or they may have different time, they can't sit for a long time and all. So what exactly these challenges a speech therapist will face when treating special needs children or young adults?
Challenges generally we face is related to awareness, most importantly, because there's a very limited awareness with a layman and even with the professionals that the speech therapist, what all things they can do and where is the speech therapist available, etc. So one thing, awareness wise, like these kind of programs are very important so that people do understand that okay, a speech therapist has this certification, or this is how I can search for a therapist, etc. So challenges number one would be awareness based list. Next challenge, like you said, there could be a hyperactive child. So yes, we are also trained in treating a hyperactive child, but it's always a team approach that we really prefer. So there is going to be a psychologist that you require a physiotherapist, a neurologist probably. So for various problems there are various professionals which are required. To finding the right kind of team is the other challenge. So you should have, if I am extremely dedicated, I should have the other professionals also who are equally working with me, or I give them the credit, they give me the credit, and we work for the development of the child. So the next thing, finding the right team is very challenging. Third thing which is very challenging is now speech problems. Generally it is not like I took a pill and then I became fine the next day. So it really takes a long time, most of the problems. So it can be the simplest problem like stammering. It really needs a lot of dedication and, let's say, change of lifestyle or some patience from my side to start treating myself, or from my family members also. So this kind of this long term process is another challenge. Everybody in especially today's life, you want fast changes in your life.
Right, when you are saying, sorry to interrupt, parents think, okay, there's a cure for autism, I send to a speech therapy, my child will start talking.
Within days it should
they
be.
think, okay, my child has a problem, they're not ready to accept that it's a long term thing, it's a disorder, we have to work. They think, okay, I take him to a speech therapist, he'll start working, if otherwise the speech therapist is not good, and he'll become okay. Correct. That is the mentality.
In this case, see, what they should really look at is whether the progress is there or not.
Yes.
So from, let's say, 0, I cannot expect 100 ka progress. There should be a progress of 10, there should be a progress of 1 at least. So again, searching for a good speech therapist, they should also, I will not say that the speech therapists are also very good. So they should also really explain this thing to the parents that, okay, this is what is happening. Your child has progressed from 0 to 1. So this is what is, generally should be shown. This is a very big challenge, that it takes such a long time that parents or any person also, they lose this patience.
They get frustrated also.
Yes.
That's correct. Parents sometimes think, okay, it's like a magic thing, we take them therapy, put them in the center, means our work is over, he'll be treated. That's what the parents think. But I think it's, at the end of the day, it is a teamwork.
Yes.
From the parents, from the therapists, and not only a speech therapy, I think. Other therapists all together only can work, not only for speech, for anything.
True.
Again, parents sometimes they get fed up, taking here, taking there, they don't know what to do. Yes. So what you said was,
having the belief and having the patience level is very important.
I think, yes, that's, I think parents out there need to have a lot of patience, love and hope. Never lose hope. Something will work out. So parents, please see that you work together with your therapist, and one day you will see the results.
True.
So, and this the therapist will work on what particular areas, doctor? Because we go to a therapist, the speech therapist has to get to know the child, know the person, the family, and then start having a connection. I think directly you can't work.
Right.
So can you elaborate on all the areas of the problems a speech therapist will treat?
A speech therapist, like you are talking about, is of course treating the children. So in case of children, there is language problems, like I explained. There are fluency, voice related problems, articulation problems. There are also swallowing and feeding problems. So a lot of autistic children probably will even have difficulty in feeding. Feeding as in they will eat a particular type of food, let's say crunchy food, so it's only chips and all that they are preferring. So there are sensory difficulties like that which are at the level of the feeding also. So this is also another domain which speech therapist would deal. Other than the children, we also deal with adults specifically. So let's say there is a person, let's say I am talking completely normal till, let's say, 30 years. At 30 years, I met with an accident or had a stroke or something, and I lost my speech. So at that point also, a speech therapist is going to help in the rehabilitation. Also, it could be dementia, Alzheimer's, it could be among adults, it could be a stammering, voice problem, or again a swallowing difficulty. So all these areas is where a speech therapist is going to play a very important role.
Okay, I think if I could include echolalia also.
Yes. It's one of the speech problems. So again, in the sessions, now echolalia is nothing but imitating something again and again, saying something again and again.
Especially it's seen in autism children, they tend to repeat the last words.
Right. So again, at this point, it's again, since they are repeating things, it's again related to your speech. So we have a few treatment strategies which are repeatedly, given to these children, and they can come out of this problem. Yes.
That's wonderful to know. So they'll be using, I think, different type of techniques. Speech therapists will not go on same way with all the children.
Right.
They have different techniques.
Yes.
So can you tell us something about some of the speech therapy techniques?
The techniques, yes, as you said, different problems. Let's say it's a stammering problem, it's going to have different strategies. A child with autism is going to have different strategies. Even among children, autism is going to be different. The let's say Down syndrome is going to be different. Some common strategies, if I have to label, there is something called as PECS, which is Picture Exchange Communication System. So when the child is not talking, you start using pictures and you ask the child to start communicating, and through this you even keep giving a speech stimulation. So you keep telling them this is how you are supposed to, label certain things, etc. Or it could be something called as cued speech. So let's say there is a problem which is anomia, where people are not able to name certain things. So if I'm not able to name things, I am given a picture, let's say a picture of an apple, and then you write a dash dash dash. So again the person is supposed to see the picture and then complete the whole sentence. So it could be that kind of techniques. Or let's say in stammering you have there is something called as use of metronome. These are beats that are given. So if I'm a very fast talker, I could end up in having a stammering. So in that case I can use these beats repeatedly. These beats can even be worn, and then I can wear this, keep listening to those beats and then talk accordingly. It helps me reduce down my speech. So like that, there are various techniques for different problems that are used by the therapist.
Now there are a lot of technologies also which are coming, like with the help of a tab.
Yes.
Or some apps are there.
Right.
So are they
these
really helpful?
Very, very. These are called alternative augmentative communication. So let's say I'm not able to talk out my needs or tell my needs, and then I get very angry because how do I communicate now? So in this case, generally communication, now for a speech therapist, other than speech and language, it's the communication which is the main target. So when communication is the target, these tabs are very, very helpful, because it even may start eliciting the speech. So if I keep opening the tab and showing that it is an apple that I want, over the time probably I will even start talking it out, because now it's easier to communicate. My tantrums will automatically
Speak
come
aloud
down.
when you press the button.
Yes, they speak aloud. So again, when they speak aloud, it gives me also a stimulation. So one thing, it can add on to my communication, or it can even improve my communication.
I think these technologies which I've seen some latest YouTubes, children with special needs, they are able to study further also. They are able to, whatever is there in their mind, especially for autism children, I think.
Yes.
They're able to tell what is in their mind or in their heart. They can.
Also, it's very useful for, let's say, children who are intellectually disabled and have a profound degree. So the IQ level is so less that they are probably not able to solve a lot of things, the cognition wise. So in that case, it is very easy to use these kind of tabs which become aids for these children. They can in future start using these aids. It's easier to use the aids when compared to thinking, calculating and things like that.
Right, I think. So many children, I think they can be benefited by use of these technologies,
yes.
which we didn't have many years back. So the parents now are more luckier than parents back then.
Plus, somewhere we need to understand that child, see, nowadays you cannot take children off the screen time. So screen
True.
is something they are really very, in for. So the minute you start using the tab, probably the chances of them talking or them being interested into things again starts increasing.
Right. I remember when my son used to be small, they used to say just switch off the TV, and screen is not good. But I think that can be used as a benefit for our children.
Now again,
Right.
I will not recommend sitting in one corner with a tab and seeing rhymes or seeing videos and things like that. Whereas using the screen for the right thing is no harm.
Right. I think there should be time limits for everything.
Yes, true.
Everything in moderation is
good.
That's good, doctor. Thank you. And here I would like to ask, what are the benefits of speech therapy? Because sometimes parents cannot afford, or parents are not able for any reason like health, or the child has epilepsy, or any other reason they are not able to take. So for them, they need to go to a speech therapist. What are the real benefits of speech therapy? Can you please tell us something?
A very common benefit is going to be communication, like I said. So what are we doing with speech is I'm trying to communicate with you. What am I doing with my language is I'm using this English words to start talking to you. So ultimately it's going to be communication that is going to be helpful. If we are talking about tabs, again these tabs are going to communicate. So anything said and done, the speech therapy is going to ultimately help me start communicating. So for those parents who specifically cannot say continue the therapy, or for some reason you are not able to take therapy for a short time, keep focusing on this kind of communication. So if it's speech related communication, ask your child to say something aloud so that he can communicate using his speech. Let's say the child is non-verbal, then take the tab and then communicate. So the basic bottom line for all these things is it's going to help us in communicating.
I think, if the parents are not able, they can also learn themselves teach the child. There's nothing like you can't do. If you really put your mind to it, you can do anything for your child.
Right.
So, doctor, again coming back to learning disability in regard of speech or any other issues, can you describe what exactly it is and how teachers can identify it and focus on it?
Learning disability, as the name suggests, so it's a problem in learning things in terms of the academics. So let's say you have a student in the class who is not able to perform well in spite of a lot of his efforts, like you might have seen in the movie Tare Zameen Par. So
that's a beautiful movie.
Yes, so again that's a very, you can say an eye opener to show people that this is how a learning disability kid is going to be. So this is not something that I'm doing intentionally. I am putting my effort, I'm doing a lot of things, but things are not working out in the right direction. In which way? In my reading related things. So there is something called as dyslexia, reading problems in that, there are writing problems in that, and there are mathematical related problems. There could be some processing related problems, or because you don't process or understand things in the right way, there could be tying shoelaces, these kind of fine motor skills. So in the movie you might have seen him fidgeting around with tying the tie or the shoelaces and things like that. So again, these are the areas which are specifically difficult for these children to perform. So to identify this kind of problem, you would see reversal of letters, you would generally see the kid performing in all the areas, say extracurricular or sports, everything is going to be okay other than the academic related things.
But all those who have learning disability, is it that they have speech problems? Or it may or may not be there?
It may or may not be there, but a lot of times children, let's say the special children, may end up having reading writing difficulties because the brain areas are all related, and your perception, basically if it's not there, perception is understanding, if this perception of information for language areas is not there, the same way it may not be there for reading, writing and all these activities also, because ultimately you require your cognition to work in the right way. So probably the reading writing difficulties would be seen in these kind of special children, but learning disability altogether is a completely different diagnosis.
And some of these children we have seen, they are saying okay, at home they are talking, they are able to say poems, they are able to, but when it comes to speaking a sentence or going out and talking, they are not talking. So that again is another speech issue.
This is something like, you can say rote memory, something that is already there or automatically coming out, or let's say I learnt a rhyme, I'm very interested in the rhyme and I said it out, but socially I'm not good enough, or in my communication again I'm not good enough, so I sit all together by myself, I say the rhymes, but when it comes to communicating to people, that is where I have a problem. So this is an indication that my child is not non-verbal. The child can talk, but he needs training, again speech related training, he needs some pragmatic group sessions where socializing becomes a viewpoint of the therapist, should be the pragmatic skill. So again, in this kind of socializing, the child will start talking with the
I think
people.
socialization is important aspect because parents need to take the child out more.
Right.
Then only they will start meeting and discussing, because we keep our child home thinking they have special needs and they don't get to communicate with others.
Correct. And they don't see the situations. So that's the reason they don't come out of those situations.
True, doctor. I think all parents out there need to know speech issue is not limited to home. It can be of any part of the disability. Please be careful, don't lose hope, empower yourself, take them to the therapist, look out for other therapists which can help you. It's a teamwork, and like doctor pointed out, there are movies which enlighten so many people, like Tare Zameen Par. We need more movies, I think, like that.
Right.
And parents, please take out your children, meet other people. Support groups are very helpful where you can meet other parents going through the same issues. So the children will also try to communicate. They learn from imitation, I think, very much. So even speech can be imitated when others speak.
Right.
So please, if you have any speech issues, hope this is very helpful for you. And if you have any queries, please do write to us at News Karnataka. You can contact Dr. Ramandeep too in regard of these issues. So before we close this session, Doctor, what message would you like to give through News Karnataka?
The very basic thing that I would say is awareness is very important. So probably after this program, I would expect parents and the other people to know that the speech therapists are going to be available at any point. You don't have to really run from one doctor to the other, or from one neighbor to the other, from one professional to the other.
True.
Again, searching for answers to the questions like, okay, my child is stammering, what to do, or his speech is not clear, what to do. A basic indication is when the speech is not clear, or when your child is not talking appropriately and you feel there is a problem, directly go to a speech language pathologist to ask for the answers. So the diagnosis is of course going to help you, and the therapist is going to tell you, even if you cannot attend a therapist, the therapist is going to tell you these kind of things. So again, this awareness is very important. This is what I would like to say through this program.
Thank you very much. Everyone, those who are having special needs children, please empower yourself. There are therapists, there are specialist experts out there. Through this Walk the Special Path series, we are trying to bring you more and more experts so that you are enlightened and you get some knowledge. If you have any doubts, queries, please do write to us. There are experts out there who are ready to help you. So please do not lose hope. If you have speech related issues, we can't say it's exactly a cure, but there are ways to improve it. There are people who can help you. Please, you have to look for the person who is comfortable with your child, who's patient and kind to be with your child, and who's also an expert in their field. Please check the credentials, see it's the expert with your child, and learn from that expert so that later you can also be a speech therapist for your child in your home. So thank you everyone for this show. Thank you, Dr. Ramandeep, for being with us and enlightening us with so many aspects today. Thank you everyone.
Thank you.